Hello! Whether you're watching this video in your pregnancy because you know that your baby will have to spend some time in intensive care unit, ICU, or you're watching this video because your baby is currently there unexpectedly, well, you've come to the right place because I'm going to tell you some tips to survive this really delicate period of time in intensive care unit as a mother and family. My name is Ilenia, I'm a midwife. I've been a midwife for nearly a decade and my baby spent himself some time in ICU when he was born. So I'm going to tell you what you can do to make the most of this time for you and your baby. The first thing that I want you to know from a midwife point of view is that your baby needs touch. Touch is a sense that they use the most to experience the world in the extrauterine environment, and you have to make sure that they recognize you and they know that you're there as much as you can. The best form of using this sense is through skin to skin. Skin to skin is when your baby is placed onto your bare chest. He or she is naked, just with a nappy and the lines and the tubes that are obviously there to make sure he's safe and healthy. That this would be the most of touch that you can do, and use every occasion to do skin to skin. Don't be worried because your baby is tiny or because there are so many leads and cannulas attached to him or her. The nurses will help you to do that. As soon as your baby is stable enough to manage skin to skin, please do it. However, if you cannot yet do skin to skin, make sure to reach through your baby through the incubator, for example, but make sure that you can touch and feel your baby as much as you can with gentle strokes, or simply posing your hand next to his hand or her hand, and make sure that you touch him as much as you can. He's your baby, you're not gonna put him or her in danger. Just make sure that you have a healthy hygiene of your hands, and your baby will highly benefit from your presence and from being touched. Another important sense that babies use is smell. Therefore, what you can do to make sure that your smell is there with them all the time is to place a little piece of fabric, like a cloth, onto your chest, okay, or inside your bra. Wear it as much as you can and put it in the incubator or next to him or her as much as you can. This will make sure that your baby have a little bit of you every time, even when you cannot be there. You can also use a little lovey as well, anything that can really get soaked with your smell, or the other family member's smell as much as you can, because your baby knows you and is familiar with your smell, and therefore it would be really lovely for him to have a little piece of you even when you cannot be there, or even if you're there but you cannot do skin to skin every time. This will ensure that a little bit of you is always in contact with your baby. The most valuable tip that I can give you as a midwife for your baby is to get as much colostrum as possible as soon as possible. Colostrum is the first milk that your breasts will produce when the baby is born. Now, technically this can be done also in pregnancy. However, if you didn't know that your baby was gonna end up in ICU, or you didn't have time, or you just simply didn't know, maybe you don't have colostrum ready antenatally, and that's absolutely fine. What you can do as soon as your baby is born is to start expressing. There is a technique that will enable you to express colostrum, and then you can use special containers to make sure that the milk is stored sterile, but it can be given safely to your baby. Now, if your baby is not ready to eat, and that can happen if the baby is premature, for example, or they're being fed through the feeding tube, don't worry, because colostrum is so valuable, it's so rich of anticorps, nutrients, calories, that it will be so important for the baby even to have their lips moisturized with it. So don't worry if your baby is not actively eating anyway. You can use colostrum so much for their skin, for their eyes, for their mouth, for their lips. So it's important that you express as soon as you can and as much as you can. Don't worry if you don't see a big amount at the beginning, especially if you had a premature baby. Your milk might take a little bit to come in, and maybe you had a cesarean section. There are risk factors that will make your milk to come in a little bit later, but don't worry, it's actually through stimulation and expressing that you'll make this process faster. So don't give up, just keep expressing manually in the first hours or days, and then you can eventually use an electric pump. However, colostrum is so precious that we need to collect every single drop, and this can be collected the best manually. You're going to spend a lot of time in ICU. The nurses will become your second family, and your routine will be definitely different than what you expected. It's very important that you mind yourself and your mental health. So make sure that you rest. I know you'll want to spend 24 hours a day there, but you need to sleep. You need to have a healthy diet. You need to keep yourself hydrated. This will be so important to make sure that you have enough milk, and in general that you just feel better and you're able to look after your baby in ICU. Don't underestimate the importance to look after you, because if you are on top, then you can look after your baby. Don't think that just because your baby in ICU, you need to just spend as much as time with him or her as possible and just forget about yourself. You are important too. So if you are not fed and rested, then the chain will just collapse and a lot of things will not just work well. So please mind yourself. To mind your mental health, is important that you go for walks, that you take care of yourself, having a shower, going to the hairdresser, going to have a massage. It's really important that you celebrate being a mom, although you don't have your baby with you. If you need something to do while you spend time in intensive care unit, maybe you cannot hold your baby just yet, or you just have a lot of time there watching him or her into his little cot, what I suggest you to do is to write a diary. If you write a diary with what baby does every day, it will be amazing to look back and to see the progress that he or she has made every day. Trust me, you will forget how much you've come. When you are there every day, it's really hard to see the big picture. But when you look back through a diary, for example, you really can see how far your baby has come. And I will really encourage you to ask your nurses to write a few lines every day, or maybe at night when you're not there, because it will really make yourself feel just less anxious to know what your baby has done while you were not there. Remember that you cannot spend all the time there, although you want to. So make sure to take turns if you have another partner or a visitor that can help you to swap, because it's really important that you take some time off for your mental health. All the other tips that I gave you regarding touch, smell, milk will not just work if you do not look after yourself. And this is my take-home message. You just become a mom. Give yourself some grace. You matter too. Your baby needs you at the most, and to do so, you need to take care of yourself. Bye bye.